Our story begins in the 19th century, 1828. The Jewish population under the Ottoman Empire counts 6,000. 2,000 of them live in Jerusalem, and the rest are settled in few other cities. Not a single qualified physician in the country, Jewish or non-Jewish. Only quacks, pharmacists and healers are giving medical services. A high level of sickness, high death rate, mostly in children, shocked Sir Moses Montefiore, the leader of the Jewish community in England. Sir Montefiore decided to improve the Jews' medical condition and the proper medical services. His plans did not come together that year. Dr. Frankel arrived in 1843, opened the first Jewish clinic. Montefiore's clinic marked a new era of medicine. The opening of the Mir Rothschild Hospital. It had 18 beds and was the first Jewish general hospital. The first cooperative agricultural communities, Moshav, financed by Baron Rothschild, are built, and by then medical services are not available outside of the cities. During the Second Aliyah, between 1903 and 1914, the pace picked up, and initiatives towards creating a health fund for agricultural workers were on the agenda. Dr. Sonia Alexandra Belkind started the first medical service for women, which lasted until 1917. Henrietta Zold visits Jerusalem and is shocked by the terrible health conditions and misery of the mothers. She discovered her life's mission, the health, education and welfare of the Yishuv. The General Health Fund was founded by Jewish agricultural workers, and it became the first public health institution. By 1918, the General Health Fund established a network of clinics for labourers, offering accessibility and availability of medical services throughout the country. Together with 6 other women, Henrietta Zold founded Hadassah, which recruited American Jewish women to upgrade the healthcare. Henrietta Zold approached Nathan Strauss in 1912, and a year later he established the first Mother and Child Center. This initiative was part of the effort to lower infant and maternal mortality, and to further health education among mothers and mothers-to-be. A mass immigration of doctors to the land of Israel multiplied by 5 times the population of doctors within a decade. In 1925, the General Health Fund initiates a law proposal for compulsory national health insurance. 70 years of political struggle will pass till its fulfillment. The Emergency Medical Services Red Shield of David organization was formed by nurse Karen Tenenbaum as a volunteer association with a single branch in Tel Aviv. Today, the Emergency Medical Services is staffed by more than 1,200 emergency medical technicians, paramedics, 10,000 volunteers, emergency physicians and a fleet of over 700 ambulances. The Amamit Health Fund was founded in 1931 by Hadassah. The National Health Fund is founded. The General Health Fund joins the Federation of Labourers and becomes the largest public health organisation in Israel until 1994. The Clalit HMO was the only organisation to accept members without discrimination based on age or medical situation. The health market becomes competitive. The first teaching hospital, the Rothschild Hadassah University Hospital, opens. The Central Health Fund is founded, and the Maccabi Health Fund is founded. The School of Military Medicine was secretly opened. The decision was made to build a medical service similar to that of the British Army. Today, the Israeli Medical Corps is an Israel Defense Forces Corps, responsible for providing healthcare services and medical treatment and instruction to all levels of the IDF. Alongside the public healthcare services, private health services emerged. On Thursday, May the 14th, 1948, the State of Israel was declared, following the end of the British mandate.
אנו מכריזים בזאת על הקמת מדינה יהודית בארץ ישראל. היא מדינת ישראל.
The health institutions and hospitals left by the British were transferred to the Ministry of Health. The first medical school in the Hebrew language opens at the Hebrew University in Jerusalem. The Hebrew Medical Association, HMA, changed its name to IMA, Israeli Medical Association. The compulsory national health insurance law is implemented. This law ensures that all Israeli citizens, without discrimination, are covered by health insurance and provided with a uniform benefits package, while having the freedom to choose and transfer between HMOs once per year. Members of each HMO also have the option to acquire supplementary insurance, which provides broader treatments and services in addition to the basic NHI coverage. After 70 years, the NHI law broke the historical link between the health funds and the political system. Israel, present day. Population 7,933,220. 100% of the population has wide public health insurance. 4 non-governmental competing health funds. 76% of the population has complementary health insurance. Low infant mortality, 3.7 to 1,000 live births, and life expectancy of 81.8 years. 10 years more since 1970 and the 4th in the OECD countries. 5 public medical schools. 22,300 employed physicians. 12,100 serve in the public healthcare system. 37,600 nurses. 48 general hospitals. 288 hospitalization facilities for rehabilitation and/or long-term care. 1,000 mother and child clinics. 2,000 primary clinics. A clinic per capita ratio, the highest in the world. Israel has established one of the most enviable healthcare systems among OECD countries in the last 15 years, since it legislated mandatory health insurance. In just 100 years, Israel made a giant leap in public healthcare services, offering efficient healthcare for all, from infancy to old age.